And if you want to tell people a little bit about your background before you get started, that would be awesome.
So I originally was a trainer back at Good Life, probably 2003, 2004, 2005. And I saw a lot of clients who loved working out, but they had a lot of pain with the shoulder press. They couldn't do squats. And it also translated into their kind of home environment, right? Where they had low back pain, so they couldn't pick up their kids. A couple of gentlemen who, wanted to lift their kids up to do airplane over top of their head, but they weren't able to do it because of shoulder pain. And I loved my job, but I just felt like there was almost more that I could do so that I could get them to be fully functional, pain-free, and be able to get them back to the gym and be able to do everything that they wanted to do. So I completed my physio degree back in 2007, I think. So I've been working in a private clinic for the past couple years, and I branched out on my own September. So this whole storm has been a little crazy for my business. But I want it to be different. When you go to a lot of clinics nowadays, it's usually you'll see a lot of quantity over quality. So at our clinic, it's one-on-one with a physio, 30-minute sessions with no assistant, so that you really get what you pay for. And we really focus in on the patient's functional goals, what they want to do, not what I want to do, what they want to attain. So it's been an awesome experience. We've had some really great feedback. So now we're branching off into kind of doing some webinars over the next little while, just to try and help people at home, since we all are stuck at home, and see if we can continue to help the community. You just muted yourself.
Whoops, am I back? Okay, sorry guys, I'm not that new at this. It's just obviously early. Anyways, so thank you for like the little bit of intro, but if you could kind of share about like why lower back pain has been something you've decided to focus on a little bit.
Yeah, well, actually you and I had talked a while ago about both having kind of experience with low back pain. And it's probably one of the most common things that we see in the clinic. It's the leading cause of disability in North America, which is huge. Like you said, 4 out of 5, or approximately 80% of the population, have either one episode or more of low back pain. And I honestly believe if we learned, or had the opportunity to learn about low back pain a little bit more, not just why we have back pain, but learning how we move, usually we're able to kind of treat the low back a little bit better. And the clients are able to understand and treat the low back a bit better too. Mm-hmm. Now, out of everybody that's here, does everybody currently suffer from low back pain, or have you in the past suffered from low back pain? So if I can see you, nod your head. If I can't see you, let's see you put up a comment.
Yes. My lower back pain, and I'm sure a lot of people, I feel like it's a consistent lifelong thing. It's something that you have to learn how to manage. I've had mine on and off since I was 22 years old. So this is 15 years now for me.
Yeah, that's pretty long.
Mm-hmm.
So we've got a couple of firefighters, officers. Mm-hmm. Yeah, I think when we did the poll the other day, I think what was there 25 people that currently have low back pain, and it was over 3 months of low back pain, which is crazy. I just say to myself, people have been living with this for 3 months and not had a chance to hopefully try and reduce the symptoms that they're having. Mm-hmm. Now, one big question that I always propose to my patients, and it kind of, people have to think about it when I ask them it, and I'm not sure if you guys have seen me post it before, but the question is, are you moving poorly because you're in pain, or are you in pain because you're moving poorly?
Both.
Possibly, yeah. Yeah. Everybody kind of get the question, right? It hits really close to home because we don't really realize, even though we have pain symptoms, we just assume that there's something like majorly wrong, right? But sometimes your body just isn't moving properly, right? Maybe something's stiffer than it should be. Maybe something's moving too much. Maybe you're not breathing properly. There's a lot of different factors that can contribute to low back pain. And our goal as a therapist is to try and decipher what is affecting you, right? So when we do our assessments, usually I'm looking at the person as a whole. And out of the 10, 15 factors that can usually contribute to low back pain, I'm trying to figure out which ones apply to you. Mm-hmm. So when people ask me that generalized question, what can I do for my low back pain? The answer is, it depends, right? Actually, you'd say the same thing, right? Like what's going on with you may be completely different from Daniela, right? Or what's going on with Dawn may be different from Jen, right? But usually, as long as you kind of go through a step-by-step process of taking a look at all those different factors, and then if we can pull out those 5 or 6 factors that are contributing to your low back pain, then usually we can decipher what route to go with you. Ashley, you muted yourself because you're eating.
I did. So could you go over some of the most common reasons for back pain? I know it's all individual, but I'm sure that you see some consistency and some patterns.
100%. Now, when people think of low back pain, they just think of like the biological factors, right? So how our body moves, like I said before, what's stuck, what's not stuck, what's tight, what's not tight, what's moving too much. But as a therapist, sometimes we look at like a biopsychosocial kind of factor. So there's always the psychological concerns as well as the social concerns. So stress. Who here has stress? Raise your hand. Or type whether or not you have stress. Anxiety, depression, right? All of those factors can contribute to low back pain. And then if we also have, that more social aspect, so if we're stressed at home, if we've got a couple of bad relationships, that can contribute to that stress, that anxiety, that depression sort of issues. And people say, well, how does, stress and anxiety contribute to low back pain? When you're stressed, when you're anxious, we all know that we're kind of in this fight or flight response, right? Your chest is heavy, your heart beats a little bit faster, and when you get anxious, your breathing patterns change. And usually when your breathing patterns change, the dynamics to how you move change. I read a really interesting article the other day. Does anybody see my post regarding breathing, like whether or not you're a chest breather or an abdominal breather? So if you are a chest breather, you end up changing the dynamics to how your diaphragm moves and that sort of thing. And it actually alters the pH in your blood, which therefore then reduces the amount of oxygen that's getting to your muscles, which is pretty neat. I never would have thought of that, but on that biological kind of level, it can. So there's your psychosocial kind of effects, stress, anxiety affecting your breathing, and then your breathing changes the amount of oxygen that goes to your muscles, and then it leads to muscle tightness, muscle pain, that sort of thing. Now, the other issues that can contribute to low back pain, I have to look at each of you as a whole, right? So I look at your breathing, your posture. Now, some people say that posture is a factor. Some people say that it isn't. I say it's very patient specific. So depending on, where your pelvis is positioned can have a huge factor. So whether or not you're more kind of anteriorly rotated or posteriorly rotated of the pelvis, that can affect the low back. Your hip range of motion, whether or not you have stiff hips, whether or not, your foot structure. Anybody wear orthotics here? No? If you do wear orthotics, can you type in the chat? So depending on your foot structure, if your feet are nice and kind of, you've got that natural arch, or if you roll in, like more of a flat foot, or if you roll in when you walk, that can have an effect as well. And then with respect to your mid-back mobility can have an effect on your low back. So it's basically like an entire chain. Your neck, your mid-back, your pelvis, your hips, your knees, and your feet can all contribute to your low back.
In light of the new developments.
Now, has anybody ever thought of the fact that their mid-back and their feet can affect their low back? Yeah, yeah. Montana says yes. Yeah, it really can. So when I take a look at individuals, I'm looking at how they're moving as a whole. And usually there's a basic kind of screening tests, a couple of tests that I do, which can usually give me a basic idea of who has pain and who doesn't. And most of those screening tests can give me some ideas of where to start, which is probably what you guys are looking for today, right? Yeah.
I know for me, and the most common question I get as a personal trainer is kind of like, am I overstretching? Am I or am I not stretching enough? It's kind of like the starting basis. So exactly what you're saying. It's like I've been given so much information by so many different people that it starts to feel like you don't know what to do.
Oh, 100%, 100%. So when somebody steps into the clinic or now steps into my virtual appointments, I do my screening tests. I see what's going on. I pick out their 3 or 4 factors of what's contributing to their pain. And then I talk to them about kind of the step-by-step process to how we decipher where to go with them. So one thing that I say, which actually this would be relevant to you with teaching your classes and whatnot, and trying to help people strengthen their core and that sort of thing. Does anybody here, do you think you can fully strengthen an area if you don't have full mobility? And when I say mobility, I mean like range of motion and flexibility. So most people are saying no, which is right. So if you're having low back pain and you've got some contributing factors like hip stiffness, thoracic spine stiffness, which is your mid-back. If you have stiffness in those areas and you're trying to work on core strengthening and you're trying to work on hip strengthening, you're not going to be able to attain your full strength because you don't have that full range of motion. So certain muscles can't work 100% if you don't have full range of motion, right? So as an example, everybody know what a bridge is? Right? You lay on your back, you bend your knees, you lift your bum up. If you are stiff in your hips, you can't get all the way up in a bridge. So how do we expect our glute muscles to fire 100% if we don't have full range of motion? We can't, right? So let's say you bend down to pick up your 3-year-old. Do we expect our glutes to fire 100% to help our low back when we go to pick up our kid? No. And then that is what puts us susceptible to injury. Usually when we see injuries, what's happening is your body's just compensating for something. And as a therapist, we just have to try and figure out why that compensation is occurring. Does that make sense? Yeah, maybe. So if I was like, let's say as an example, if I was to meet Daniela and she was telling me she had some low back pain, I'd assess her, find her contributing factors. And then we kind of make it into like a 3-step process, okay? So the first step that I usually focus on is flexibility. So like Ashley was saying, like, do I stretch too much? Do I not stretch enough? I will look at you and figure out, okay, what is stiff with you? What muscles are stiff? What muscles are restricted? If we can address those muscles and we can improve their length, that means that your flexibility is better, obviously, so that we can move to the next step. So I kind of have a 3-step process when I see people. My goal with everybody is usually to get them better in 6 weeks. The first step is kind of flexibility, like I talked about. The next step is kind of more so what we talk about, mobility. Does anybody know there's the difference between mobility and flexibility? Okay, so flexibility is basically the ability of your muscles to lengthen so that you can move the way that you're supposed to. Mobility is the ability of your joint, so it could be your knee joint, it could be your ankle joint, it could be your hip joint, it could be your elbow joint, your shoulder joint, to move through its available range of motion without restriction. So as an example, your quad muscle. Everybody know your quad muscle? Muscle in the front of your thigh. Can everybody bring their heel to their bum? Can everybody grab a hold of their foot and bring their heel to their bum? Yeah? So you need a good quad length to be able to have full mobility of your knee. Right? If your quad's really, really tight, let's see if I can show you guys. So if your knee is really, 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 really tight, that means you don't have full mobility. But if you've got good length, you can bring your heel all the way to your bum and you have full range of motion of the knee. Okay? And then once you can restore your flexibility and your mobility, then you can work on strengthening and stabilizing things, because the muscles can work 100%. Anybody have any questions about that?
So would you say that there's no such thing as overstretching then?
There would be, like somebody who has hyper mobility in a joint, they probably don't want to overstretch because they've already have too much movement in a joint. People like dancers, right? Gymnasts, like they have to be cautious with how much they're stretching, right? I see a lot of dancers in the clinic, a lot of young girls who need more of stabilization, strengthening exercises as compared to stretching, right? And I always tell my patients, if you do a stretch, as an example, like that quad stretch, if you do a stretch and you don't feel a pull anymore, it means that the muscle's not tight, right?
Okay. So what are some things that we could do on our own to try and figure out where we might be holding that tightness? So you're saying it could be your foot, it could be your hips, it could be your quads, it could be your hamstrings. Like, how would you be able to tell where you lie?
So there's a couple of different tests that I usually do, and if everybody's up for it, and if everybody's willing to put up their video after, what I can easily do is we'll go through a couple different tests. So you guys can decipher what's tight with you, what's not tight with you, and maybe I can pinpoint over Zoom where your issue is and sort of kind of talk about where we can get. If it's okay with you guys, who wants to kind of learn how the back, like the mechanics of the back? Yeah? Okay, let's see. Let's see if I can do this. I brought my spine. This is you, everybody. Very pretty underneath all that tissue, eh? Okay. This is low back 101. Okay, can everybody see this board? Yeah? Okay. So your low back is made up of 5 vertebrae, okay? So you got, let's see where you can see. 1, 2, 3, 4. Everybody see the 5 vertebrae almost? Close? Yeah. Okay, and then you have your tailbone. Your tailbone is kind of shaped like a triangle, okay? Now, in between each of these vertebrae, where the bottom of one vertebrae meets the top of another, this is called a joint. Okay? Most commonly, when people have low back issues, that is usually the structure that's irritated. Okay? Now, in females, does anybody notice that they have a really big arch in their back? No? So, if we look at an individual from the side, don't make fun of me because I can't draw, okay? This is you facing forward, okay? Now, there's muscles that attach to the front of the pelvis, so here. What do you think they do to your pelvis when they're really tight?
Pull you.
Pull you forward, yeah. So instead of your pelvis being nice and level, what ends up happening is you start to get a tip in your pelvis. Now look what that just did to your low back. It took a 90-degree angle and turned it into like a 60-degree angle. So this little space in between here, everything is compressed now. So if you think of everything being compressed. So what that's doing is that's putting a lot of pressure on that joint. Okay? It's tightening all of the muscles. Whoever feels like their back's really tight, raise your hand. And do you feel like you're always trying to stretch it? Maybe you're hugging your knees, maybe you're reaching off to the side, maybe you're trying to twist to try and loosen it. Everybody do that? Yeah? Did you know that the most common reason for that is probably the muscles in the front of your hip? But you feel the tightness in your low back, right? So the reason that when you stretch your low back and you bring your knees to your chest, you twist, it feels better temporarily, right? Do you know why it doesn't get better? Because you're not addressing the actual cause. So yes, this muscle's tight, so you're stretching it, but you're not actually addressing the primary reason why that muscle's getting tight. Does that somewhat make sense? A little bit? Now, there's another really common thing that I see, which is probably what's going on with a lot of you guys as well. So this is probably a major issue, okay? Now, there's muscles that attach from here up to each of those vertebrae, okay? And then you've got your leg muscles. That's one skinny leg, okay? And then you have some glute muscles here. Who did that booty class with Ash the other day? Anybody? It was pretty good, eh? Okay, so your glutes play a huge factor in low back pain, okay? The reason being, if your glutes are weak, they keep your pelvis nice and stable, nice and straight. And we're gonna do one of these tests to kind of assess your glutes later. If that glute muscle does not fire properly, do you know what happens? You wanna see what happens? Your pelvis is not straight anymore. Your pelvis is tilted down. What happens right here? Do you remember that angle that I talked about? You have a nice like 90-degree angle. Now the angle is even smaller. So what you're doing is you're compressing that joint again. And all the muscles here are getting tighter. And you know what you do when that happens? You feel like the back's tight, you stretch to the side, you try and twist, as much as you can. And does it alleviate your symptoms? Yeah, sure, for a little while, but it comes back. The reason that it comes back is because you're treating this and you're not treating the actual cause of it. So what I see when people walk into a clinic, or when I see them virtually, what they're doing at home is temporarily working because they're treating their symptoms. They're not actually addressing the cause of their symptoms. That makes sense? Totally does. People hit these like aha moments when I assess them. They're like, that totally makes sense. But if somebody doesn't teach you this, you're gonna have low back pain for longer periods of time than you need to. Once you can understand how your low back moves, then you're gonna be on a better road to recovery. So that's why I asked on Royally Fit this yesterday, what do you guys wanna know? What do you guys wanna learn? And a lot of people just say, I wanna learn how to fix my back. But I say, if you don't learn how your back moves, why it moves the way that it does, you won't be able to fix your back. I need you to understand why things happen. Because if you understand why, then you're in a better mental space. You know why it's happening. You can kind of decipher, right, I'm missing this.
Sorry, I have a question there. Well, it's actually Danielle's question, and you might be getting to this, but because you were talking about the glutes and the hips and all that kind of stuff, she's asking, how does low back pain also contribute to tight hamstrings? My hamstrings are always very tight despite stretching and working them, and that is me, Daniela.
Right. So what I say to myself, we have a test that we can do that actually assesses whether or not you have a tight hamstring. Because some people think that they have a tight hamstring when they stretch them, but are they actually tight? They may actually be a normal length. It's just when you take them to their end range, you feel a stiffness. Now, we also have to remember that our sciatic nerve runs the entire length of our hamstring. So some people, totally patient dependent, that tightness that you feel may actually be more of a neural pull. So it depends on the patient. You may have hamstring tightness, you may not. Okay, now hamstrings, remember we talked about this little guy here when he gets tilted. So if your hip flexor is really tight, it tilts your pelvis. What that's doing is that's making your hamstring get stretched longer than it should be. So it could kind of give you a false feeling of hamstring tightness, Daniela? Now, Danielle, you had another question yesterday, right? Was it about gardening, I think? You said if you sit for long periods of time, you have some discomfort, I think, correct? So what I say to myself with respect to that, sorry, I'm just trying to pull up the chat so I can see it. What I'm wondering is going on with you is if your back is not moving properly, let's say you've got a little bit of this forward tilted pelvis because you have some tightness in the front aspect of your hip. If everything's compressed and really, really, really tight, when you bend over for a longer period of time, it might just be irritating those structures because your back isn't at its optimal position. Okay, and when you're standing, they did a study a couple years ago. They compared sitting to standing, and when you sit, there's an increase in pressure, or load through your spine, 180% compared to standing. So take your body weight, and when you're sitting, add 180% of that. Crazy, eh? So if your back isn't moving optimally, then of course you're gonna get low back pain. Anybody would, right? And then I think, Danielle, did you have another question? It was something about, gardening, and then
Low back pain, and definitely like with my hamstrings, there's sometimes certain stretches, like if my knee is back
Yep.
and then I go to stretch out my leg, my hamstring will totally like tighten and
Yes.
spasm, and
Yes.
it's like
When you try to do a quad stretch.
quad stretch, and if I do too much of it, then it's like that's when I get that total like spasm,
Like a
and I
muscle
have to
spasm.
stop.
Yeah, people get that all the time. And usually what you're trying to do is you're trying to use your hamstring to bring your leg back, and then you get a cramp. Very, very common. So there's ways that I show patients how to do a quad stretch when they first start so that you won't get that cramping sensation. But that also tells me that you probably likely have some glute weakness too. Now there's a question right now about sitting for 10 plus hours a day at work. What I usually recommend 100% is getting up and walking around. So every 30 minutes, get up, walk around. Our bodies were not meant to sit for 8 to 10 hours. So usually what I'll teach patients is self-management strategies. Getting up every 30 minutes. If your work is able to get you a sit to stand desk, they're usually pretty affordable nowadays. I think they range like they start at $150. And they're ones that just sit on top of your workstation. So they're pretty amazing. And then when you get home is going in the opposite direction. Because when you sit, you're flexed, right? So you're flexed forward. Is really encouraging more of an extension kind of movement, extension exercises, a lot of like low back exercises, and stretching out the muscles that get tight when you sit for a long period of time. Now, does Ash, how long we have on this call? 45?
We have until 9, so you have 20 more minutes.
Okay, so after, I want to do a little bit more Q&A so I can kind of answer some of your guys' direct questions, and then if everybody's up for it, you'd have to come off of your no audio or no visual, but I can do a couple of little screening tests, and if I can see anything kind of sticking out, I'll kind of pinpoint and help you guys and see if I can give you guys some direction, if anybody's up for it. Yeah? Okay, so let's hit me up with some Q&A. Anybody have any questions that they want me to directly address? Oh yeah, Michelle, you like the thoracic one? Yeah. Yeah, on Instagram, we posted a couple of like mobility flows. So kind of like a short version of like a yoga flow. And they're kind of directly aimed at different body parts. So we have one for the hip. We have one for the low back. We have one for your mid back. And then we have a full body flow. And they're literally about 2 minutes long. And you can go through each one for, 1 repetition, 2 repetitions, 3 repetitions. And you can really kind of decipher where your limitations are. And the flows would be very indicative of what we talked about, that mobility and flexibility issues. So you can say, hey, this is what I have trouble with. This is where my issue is. With respect to the pelvis, hip, low back, and the thoracic spine. So they're great, and super easy to do.
You see the question there from Montana?
Yeah. How do you make sure you are stretching the cause, example, the glutes, instead of treating the cause when your back is already sore? Basically making sure you aren't pushing through pain. So the key is making sure that you're doing what's right for you and what's right for your low back pain. So that's why if we can do this little kind of test in the next little while, I can kind of pinpoint with you guys what's going on. I always give people a traffic light analogy, okay? So when you're doing a movement, a stretch, an exercise, if it is pain-free when you do it, and pain-free after, it's a green light. If you do a movement and it's a little tender when you do it, but it's sore afterwards and it lingers for a while, that's more of a yellow light, as long as it doesn't linger, 24 hours. If you do a movement and it hurts when you do it, and it hurts after, and it lasts longer, that's a red light. That means stop and don't do it again. Do we do it later? 100%, because our goal is to be able to get you fully functional. Something that you can't do doesn't mean you can't ever do it. It just means that you may not be able to do that now because something's missing. Okay.
Can you say that again? Can you go over that one more time?
Yeah.
With the stretching thing?
The light?
Like how, yeah.
Yeah. Okay, so green light, when you do a stretch, when you do a movement, when you do an exercise, doesn't hurt when you do it, doesn't hurt after, green light. If you do a movement and it hurts maybe like not even like a 1 or 2, it feels a little uncomfortable, it's stiff, it's a little tight, that sort of thing. If it hurts a little bit during and maybe a tiny bit after, but it goes away, that's a yellow light. So it means proceed with caution, right? So if you keep doing it and it gets less painful, that means, okay, you're working at it. You're working it out. But if you start doing something and it's really painful when you do it and it still hurts afterwards and it lingers, 12 hours into the next day, that means red light. And not only does that apply to stretches, that applies to like basic activity too. Everyday activity, right? It just tells you that something's missing and you need to address whatever is causing that red light. I noticed, okay, so we have another question. I noticed sometimes when I go to get out, my back almost locks. I have to sit back down and try to get up again. So when we go from sitting to standing, there's a lot of different things that need to happen. Your knees have to go from a bent position to a straight position. Your hips have to go from a bent position to a straight position. Your back goes from a bent position to a straight position. So if things aren't moving properly, mobility-wise, or if your muscles that help you go from sitting to standing, like your glutes, aren't turning on properly, then you could get that sensation. So what I commonly see is, let's say you go to sit up from standing and you use more of your back than your actual glutes, you're gonna get a catch in that joint that I was showing you earlier. So to offload the back, our glutes have to fire properly. So if you don't have enough glute strength to go from sitting to standing, your back gets a higher load. So somebody like you, Diana, would probably, I take a look at your hips, your pelvis, your hip flexor, your glute strength. I'm not really concerned. It's probably nothing going on with your back. It's probably other factors causing your back pain. Any other questions?
I say we get into if people want to demonstrate or you want to like put them almost through like a virtual assessment. I think that would be a good time to start doing that because we'll even learn from watching other people.
Oh, 100%. Now I know everybody doesn't have their hair and such done, but I would love to be able to kind of pinpoint some stuff going on with you guys. So hopefully I can help you decipher what are some of your contributing factors. So if you guys want to be involved in this, just put your camera on and I'll take you through a couple of different things and see if we can decipher some stuff. Does everybody have a little bit of room that they can back up either their camera or their iPhone or whatnot? Hopefully.
Amy, did you put your video on because you're gonna do a little demo for us? Yay!
In space. Okay, so I'm hoping my laptop should not die. Okay. Everybody's up and stretching. Okay, so we're gonna go through a couple of different things, guys. First thing that I wanna check is everybody's pelvises. So I want everybody to stand up and just make sure that your phone, iPad, or laptop is showing your hips for me. Perfect. So remember how we talked about glute strength, how your glutes play a huge factor on basically how you move, how you go from sitting to standing, how the position of your pelvis. There's a lot of different factors. So can everybody stand on one leg for me? Okay, so Dawn, I don't know if you can notice, you are leaning to the right. Daniela, can you bring your leg down just a little bit lower? Oh yeah, then you got completely off balance. So when you guys balance on one leg, put your hands on your hips. And what I want you to pay attention to, there's usually two compensations that people have. When you balance on one leg, you will either lean to the side. Dawn, balance on your leg again. She's better on that leg. Michelle, balance on one leg. Yeah, so you're either gonna lean to the side or you are going to hike a hip. So if you have your hands on your hips, what you're gonna notice is either you lean to the side if you have a weakness, or you're gonna hike a hip to compensate for that weakness. Montana, I'm trying to look at you. Montana, can you put your phone higher, maybe on a chair? Shannon, can you put your phone on a chair? And Amy, can you put yours on a chair? And Daniela, can you balance on your right leg? And then left leg. Oh yeah. Danielle, do you feel more unsteady on your left leg? You look a little bit more unsteady.
It's usually my right leg that I find I'm not as balanced.
Okay, okay. And Montana, balance on one leg? Good, balance on the other leg? Do you feel a difference between the two legs? Yeah, yeah. And Amy, let's see you balance on one leg. Good, other leg? Good, and then back down. And Shannon? She had to think about that. And then other leg, Shannon? Good. Okay, I can definitely see some discrepancies between the two sides. So what you guys want to look for, like I said, when you balance on one leg, if the hips stay level, you've got good glutes. If you don't, you're going to see either a tilt of your full body or a tilt in your pelvis, okay? So that's why I have your hands on your sides. It's hard for me to see 100%, but
especially because you got a group of people here. I just wanted to mention when I herniated my back, I was so unstable I couldn't stand up on one leg.
Oh, 100%.
So it's like a really good indicator. Like when I was going to see my therapist, I'd be hanging on to him. Like I could barely. Yeah, it's remarkable how much that's an indication. Even the slightest is
100%.
Yeah.
I hurt my back same time as you. Remember, my husband had to help me put my socks on.
Same here. He had to help me even shave.
Yeah.
Everything but wipe my butt.
Okay, so another test. Can you guys turn to the side? So what we're gonna do now, we're gonna check your mid-back mobility, okay? So what I want you to do is you're gonna do a basic squat, but I want your arms over your head. So you're gonna be like this. And back out. If you can't keep your arms over your head, that tells you that you have a really stiff thoracic spine. So Dawn, you go first. So see how Dawn arches a little bit too much through her back? Dawn, try again. And her arms come forward. See? Daniela, you want to give it a go? So see how everybody's having a really hard time keeping their trunk upright? Yeah. Okay, so Shannon, let's see you. Shannon's got a deep squat. That's actually pretty good. I was impressed there. Montana, let's see you. Yeah, so see how everybody's body's hinging forward? They're not able to keep that upright back. Yeah. And Michelle, let's see yours. She's not too bad. She didn't hinge as far forward. Did I miss anybody? Amy, you. Oh, she's got mid-back stuff going on too. Okay, so a lot of you guys have a lot of thoracic extension issues. So addressing those would be a great thing to do. Everybody okay getting on the floor? Okay, let's everybody get on the floor. Okay, so do you guys remember me talking to you about your hip flexors? Remember how we talked about that can tilt that pelvis forward, right? I'm going to show you a little test that you can do to see if you have tight hip flexors. Okay, so you're going to lay on the ground, bring your knee up to your chest. If the opposite leg comes off the floor, you have a tight hip flexor. If you can keep it flat against the floor, you do not. So you want to compare the two sides. So the knee comes up to the chest as far as you can. And you guys can analyze this on your own. If that knee comes up off the floor, it is tight on that side. If the leg can stay flat, it is not tight. Who has a tight hip flexor?
So this was the other thing I wrote to you about is, so just in doing that, when I come down with my one leg, so it's up like this, and then I put it back down, my back will crack.
Yes, sometimes it's too much. Sometimes if things aren't moving the way that they should be, you can get some clicking and cracking. Not always anything to be concerned about, Daniela, unless it's painful. But it always usually tells you that there's something going on that you could improve on. So who had a tight hip flexor here? Anybody's knee lift up when they brought the knee up? Daniela? No. Shannon, did you? Shannon, you looked not too bad. Montana, did you? Nope. Okay. So that's not too bad. Let's do a 90-90 test. Okay. And if you guys have done the flows on our Instagram, you're gonna put your front leg, just like you're doing that pigeon pose with yoga. Okay? The back leg. Let's see. So each angle is gonna be 90 degrees. So 90 degrees in the front, 90 degrees in the back. Yes, Danielle, you got it. Now, everybody able to get into that position? Now, can you sit up tall? Michelle, you can't sit up tall. Daniela, you're having a hard time leaning to the right. Montana, you're not too bad. Shannon, you're not too bad. Dawn, how are you feeling?
My one butt cheek's off the floor.
Yeah, okay.
Yeah.
And then Amy, how you feeling? Good? Okay, now switch sides. Can you do the same thing on the other side? Michelle's better on that side. Daniela, I'm trying to think if you look slightly better on that side. Montana, how you feeling? So-so. Amy? So-so on that side. And Dawn, how you feeling? Better on that side. Shannon? You don't look so good on that side. Okay, so there's your hip mobility restrictions. That's checking your hip joints, guys. Good. Okay, so we know a lot of you guys have a lot of hip mobility issues. Okay, last one. You guys go into 4-point. So you're gonna go up on your hands and your knees. Last one. So this is mid-back rotation, okay? You're gonna put your hand on your head. And can you rotate upwards towards the ceiling? Keep your hips nice and aligned, nice and straight, and then you're gonna compare it to the other side. Do you have a difference between the two sides? If you have a difference between the two sides, put a thumbs up. That means you have a mid-back rotation issue. Okay, so there's a couple of my screening tests that I do with patients. So Daniela, that was hard to twist. I know, that one is tough. That is tough, tough, tough. You need a lot of core stability and mid-back mobility as well with that one. So it's definitely hard. Okay, so that's usually the test that I do. Now, if you guys, I'm gonna write a list of, on our Facebook group of what tests we just did. If you guys had any major issues with that, what I want you to do is send me a message and I'll give you some guidance of what to work on from here. Okay.
Julie,
Yeah.
Julie, not everyone's in our Royally Fit Online Facebook group.
Okay, so
what we're gonna do is I'm actually recording this right now. I did get a notification that our recording cloud is becoming full, but hopefully it recorded the whole thing, and I'm gonna be sending it out to our newsletter, and then I'll give them your contact if they want to contact you.
what I'll do is everybody that was on this call, if you guys message me, I'll give you a free 10-minute consult over the phone. So you give me a shout, I'll give you some guidance of where to start. Because I know, like I said, if you don't realize, if you don't learn how you're supposed to move and how things can affect how you move, then you're kind of stuck, right? And I don't want you guys just treating the symptoms. I want you guys treating the actual causes of your low back pain. Okay? Anybody else have any other questions? No? Okay, awesome, awesome.
No,
so
that was amazing.
Pardon?
That was amazing. Thank you.
You guys know I hate talking in front of groups.
You did great.
100%. This was like my childhood fear. But honestly, just message me what issues you guys had with those tests. And if you need a reminder, just ask me, you know, what test did we do again? And then you can let me know and I'll give you some guidance of where to go from there. Okay. It's hard to give guidance generally because everybody, like I said, is so different, right? That if I can decipher exactly what your issues are, I can give you some guidance from there. Awesome.
Amazing. Thank you so much. A lot of people are saying thank you in the comments as well. So, and thank you guys for waking up early and doing this with us. We did put in the email that we're going to be talking about pelvic floor next week, but I think we're actually going to push it an extra week just because we have another talk that we're doing next week and I don't want it to like overwhelm people with too many things. So if you guys want to join us again in 2 weeks, all of us are women on here. I know a lot of us probably have pelvic floor issues.
100%. And then if there's other kind of ideas that you guys want us to do, let us know, because after 2 weeks we can do another one. If anybody has shoulder issues, you know, hip issues, we can kind of go from there. I'll help you guys where I can. Awesome.
Well, thank you so much, everybody. I know I'm going to see some of you on the next call, which is at 9:15, a little workout. But thanks for hanging out with us today. I hope you guys enjoyed your coffee and the little chat. And if it spoke to you, make sure you guys get a hold of Julie.
Have a great day, guys, and happy Easter.
Yeah, happy Easter.
Enjoy the time with your family.
Thanks. Okay,
Bye.
bye. Bye, Julie. Thanks.
Bye, Han. See you later.